Good morning, good afternoon, good evening, depending on where you are. Welcome to the fourth CyberPeace Lab. We're very happy to have today a great panel to discuss quite a challenging topic. And I'll be your host today. My name is Stéphane Duguin. I'm the CEO of the CyberPeace Institute, and very welcome. I don't want to go too much into a presentation and introduction. We want to have a hands-on discussion with the practitioners, so I want to give them most of the space. Just to frame the topic today, the cyber volunteers and the healthcare, the state of play. Building from an understanding across all communities that what we learned from COVID-19 crisis and the potential for attackers against the healthcare is that we need to do better than hoping from crisis to crisis to adapt. Despite the WannaCry wake-up call, healthcare cybersecurity is still lags, and COVID-19, as I was mentioning, is a harsh reminder. So the question today is how can we collectively create new models, new cooperation models, and make sure that these models interact in between each other, and make sure that we can scale, sustain capacity when it comes to defending our healthcare. So today, as I was mentioning, great panelists coming from a very different background. We'll hear the voice from the healthcare security professional, the voice of cyber volunteers that are doing the practical work of support today. We'll have a point of view when it comes to how does it fit into a wider legal framework, and also looking ahead, how can we set up cooperation mechanism and scalable solution in order to increase this resilience and capacity. So without further ado, I would like to introduce the first three panelists. Martin Konir, Chief Information Officer in the Bulovka Hospital. Dimitra, Liveri, Working Network and Information Security Expert in ENISA. And Christopher Frenz, AVP of Information Security, Interfaith Medical Center. Welcome, Martin. Welcome, Dimitra, and welcome, Christopher. And yes, starting if it please, Dimitra, ladies first, really to scope the challenge and the question. What are in your views the challenges of implementing cybersecurity in the healthcare today? Thank you, Dimitra.
Thanks a lot for the invitation. Hello to everyone. I am Dimitra Liveri. I am coming from ENISA, the European Union Network and Information Security Agency, and I am a cybersecurity expert leading the activities on healthcare in the agency. So the COVID-19 pandemic has created a completely different new reality for the hospitals all over the world. On what we have seen in Europe, we have noticed an increase in phishing attacks, in ransomware attacks that are not targeted per se to the healthcare organizations themselves, but they are creating huge issues and have a huge impact in a sector already in crisis. So, as you see, cybercrime adapts to the world around it. It is hardly surprising that in the beginning of an escalating global pandemic like the one that we are living now, malware actors have actually jumped on the bandwagon. There are specific campaigns, phishing campaigns, that are taking advantage of high demand for certain goods, of decreased mobilities and border closures. So overall, an already impacted sector such as healthcare has on top cybersecurity issues to face. The need for collaboration, the need for information sharing is something that has become evident, and this is why most of the member states now work towards creating, apart from the other activities and initiatives that they run, work towards creating mobile applications for COVID-19 tracing. And to support these actions, the national cybersecurity authorities, with the guidance from the European Commission have issued a toolbox on what are the specific cybersecurity, data protection, interoperability requirements that should be met for these mobile applications that are voluntarily disseminated to the citizens. So there are many initiatives taking place now. There is a huge tendency towards information exchange and collaboration, but still the challenge is that the sector is very impacted, and there is a need for more resources and operational capabilities.
Thank you, Dimitra, for this open, very insightful, and then building on what you were saying in terms of what is the framework, I would turn to Martin, and Martin, from on the ground, you're working in Czech Republic. Can you brief us in terms of what is the operational reality? How do you face with this situation on operational level?
Okay, well, when I came first to the hospital, and I came from the financial sector, I was pretty much surprised on how big the technical debt is there in the healthcare, at least in the Czech Republic. Because in the banks, in the other financial institutions, we were at least compliant. And very often we also were much far in front of what we needed to be compliant with. In the healthcare, I came to the situation when we are not compliant with what we should do. We are not doing the best practices. We don't have money. We don't have people, and we have technical debt that was building up for 10 or 20 years. There are several reasons why we face this situation, and that also come in coincidence with the challenges we are facing, where one of the biggest problems I see is that in the healthcare sector, the managers and the people who take responsibility are usually far away from the IT field, and that's the biggest challenge that I am facing, and that's when we want to get some money, some resources for the IT, and the security is part of the IT in this case, then we are competing with caring for the people. In the healthcare, the caring part is much more expensive every year. It's even the healthcare, our delivery, our basic purpose in the hospital is not doesn't have enough resources for itself. So the IT is on the is number 2, number 3, or number 10 even in the view of the management. The other biggest challenges for us are our users, because healthcare professionals are usually lagging very much in the IT field. Users in other domains like finance or manufacturing are usually much ahead in the understanding of threats, cyber threats, of understanding how they should behave when using informational systems. The healthcare professionals are greatest minds in their field, but they are usually lagging behind in the IT security. So it's pretty hard for us to advocate our need of investments and even to teach these users how to behave. And as we know, the users are the biggest hole in every defense system, in every system of defense. So that are basically two biggest problems we challenge. And to add something to what Dimitra said, in Czech Republic, we had 2 weeks ago direct attacks on the healthcare system, just among these COVID crisis. And we needed to make very hard and very tough measures to overcome this, to stay safe. So for example, in some hospitals, me included, we were putting some systems offline just to be able to survive this, because we know we don't have the correct systems, we don't have the correct defense. So the situation is really harsh.
Thank you, Martin, for this testimonial of what is happening in the field and explaining also what is the situation in Czech Republic. Interesting what you were saying in terms of this tension in between the fact that healthcare is expensive and there's limited budget, and that's at the end of the day someone needs to make a decision in between where to invest that budget, and also the general capacity, IT capacity of healthcare professional. Just a technicality, Martin, if you can have your mic closer because the sound is quite faint. Thank you for this. Christopher, on your side, so working in Brooklyn, in a place that is one of the biggest epicenter of the epidemic today. What kind of tactical response could you put in place? How do you read the capacity of the healthcare in this context from the cybersecurity point of view?
It's definitely a challenge, and I agree with everything said so far by both Dimitra and Martin. A lot of the same challenges are faced by U.S. hospitals. There's a lack of cybersecurity talent working in healthcare. There's a ton of legacy systems. And this pandemic has made things even worse in a lot of ways, because in order to cope with the surge of patients you're seeing in the pandemic, one of the things is hospitals have been forced to expand remote access, add telehealth, add all kinds of medical devices to the hospital network in order to deal with the surge of patients. And all this had to be done in a very rapid manner. And a lot of hospitals didn't take the time to do proper risk assessments on the security side. And I think one of the major challenges that hospitals around the world face is that, unfortunately, cybersecurity is not yet equated with patient safety, and it really needs to be. If you look at the WannaCry attack mentioned earlier, one of the interesting things is that WannaCry did not only encrypt computer systems at hospitals that it hit, it also encrypted a lot of medical devices and devices like that as well. Devices hooked to patients, devices being used to patient care. And that obviously has a direct impact on how patients are cared for in a negative way. And one of the things that we really need to learn is that cybersecurity in a modern hospital really is equivalent to patient safety. One of the things I'm very big on to help promote security within my own organization is I'm very, very big on running mock incidents. Like, for example, one of the incidents we did, speaking of ransomware, is back in 2015, we wanted to actually see what kind of damage a ransomware attack could do to our hospital. So we took the ICAR test string, which for anybody not familiar with it, it's a harmless string of characters that years and years ago, all the AV makers got together and agreed to treat as a virus. So it provides a relatively safe but effective way to test antivirus and other security systems within your organization. So we took a PC, and unbeknownst to the rest of the hospital, I wrote a script that then tried to spread that ICAR test string to all the other computer systems within the organization. And we executed the script one day without the knowledge of anyone else in IT, anyone else in the hospital, and really wanted to test how the hospital would respond to an incident like this. And it was a very, very interesting exercise to do. We learned a lot about both how the people responded and how the technology responded. We learned what controls were really effective, what controls weren't. And one of the things that was very interesting is we had a segmented network at the time. So unlike a lot of hospitals you hear are taken out by ransomware because their network is completely flat, we did have a segmented network, but it was segmented by department. And one of the lessons we learned from doing that exercise was that, yes, segmentation was a highly effective control, but that as a hospital, if we were to lose our entire radiology department or our entire nursing department, it was still going to be catastrophic to care. And that's one of the things that got us really looking forward and figuring out how we could take network segmentation to the next level. So we're actually a hospital who went down the zero trust road, and we've been a completely zero trust network for a couple of years now. But I realize that's something a lot of other hospitals haven't given any thought about. But one of the things I would recommend in terms of actually knowing what the challenges to your health system are is to actually simulate some attacks, go through the scenarios, see how it's going to impact your organization, and that'll help you make much more informed decisions about how to proceed in terms of how to train your staff, how to implement certain security controls, what should be implemented, what doesn't work, and you can probably do away with. And it's also a great way to build up support among others in the executive team, because you can really concretely see what the impact would be of an attack like that.
Thank you, Christopher, for this. To react on something you just mentioning in the opening, you're saying that cybersecurity is equivalent to patient safety. Is that something that the other panelists share in terms of finding, because it's a strong one? And how do you feel if that's the case, or if not, welcome the comments. But if that's the case, how do you feel this is understood at a different level, at operational level across the healthcare, but also Dimitra, for example, when it comes to the towards regulation and framework decision?
So I think we all share the same views, but eventually it's not us that takes a decision on the investments that should be done inside the hospital itself. So it is unfortunate, but it's always the case that something bad must happen for the critical sectors to understand how much is at stake. So as it was already said, WannaCry somehow rang the bell for some of the sectors, and eventually in healthcare as well. But now with the pandemic, we have noticed that eventually the hospitals were not ready. Of course, the situation is different because all the efforts have been shifted towards patient treatment. But eventually this shows why more investments on cybersecurity should have been done from the first place. This is also something that not all the member states realized when they started discussing about about identifying critical sectors under the NS directive. It's the cybersecurity legislation here in Europe. And most of them were actually criticizing why healthcare should be under the umbrella of cybersecurity legislation like that. Eventually, hospitals are one critical sector. Cybersecurity is one of the priorities that should be there, and I'm sorry to say, but investment activities towards information sharing, towards instant response, towards capacity building will be done after the pandemic has taken place. We see the community moving, but it happened now, and this is a pity.
Thank you, Dimitra, for this. And Martin, building on what Christopher was mentioning, this appetite for testing, to walk the talk, really to invite the community into understanding what is happening and there's a way of taking risk around this. Is that something that you welcome or that you relate to, and how this is happening in your field?
Well, we are in a bit different situation. Because we really know where our gaps, where our deficiencies are. I have many companies, many volunteers willing to help me with identifying the deficiencies, the holes I have, and I know pretty well where I have them. But it's pretty hard for me to solve these issues without financing, without talented people on my field, and stuff like that. So I think it's really important to test, to try to go through, to do audits, to know where are our problems. But it's not helpful if we can't solve them afterwards.
Yeah, thank you for that. So just, and also to open for the next panel, looking at all these networks that are now creating, like engineering themselves in order to provide help, this willingness to help that is there. And you're mentioning that the understanding for everyone is that cybersecurity is equivalent to patient safety. You know your issues, you know what needs to be happening. There's a strong issue when it comes to finance, investment, understanding at some point in certain area. How, on your end, would you welcome help, or what kind of help do you need?
I think the Cyber Threat Alliance for COVID-19 has been a great resource. I think the Cavalry has also been a great resource, has done a lot for hospitals. I think a lot of these volunteer efforts have done a really great job and are doing a great service for healthcare. Because as Martin mentioned, one of the problems in healthcare is not just a lack of technical resources, it's a lack of people to actually do a lot of the cybersecurity work. You may very well know what your deficiencies are, but there's not the resources to help you, mitigate them or put proper controls in place. And a lot of the work these organizations do are really helping hospitals because they provide ways to provide better threat intelligence. In the case of the COVID-19 Cyber Threat Intelligence League, in terms of I am the Cavalry, they've done a lot of work with the FDA and other regulatory bodies to help ensure that devices that we're installing are safer. So a lot of these efforts have really, really benefited hospitals, and I do think they're a great thing. Because in general, you see in the US, there is a shortage of cybersecurity staff. It's hard to attract staff to healthcare. One of the problems is healthcare does tend to pay less, at least in the US, compared to other industries. So if you're a talented cybersecurity professional, why should I take the job in healthcare when I can take a job working for a bank or something else that's going to pay me, a premium over what I could make in the hospital? So attracting talent and getting budgets to actually implement security in hospitals is a challenge, and I think it's a challenge pretty much all over the globe right now.
Yeah, thank you, Christopher, for this one. Please, Martin.
If I can add to this, what I very often encounter is that I'm discussing with some great people from private sector who has the great experts, because they can pay them, that if they could help us. And they very often say, well, that's our business. We can't help you volunteering because that's our business. We won't be alive if we do this as volunteering. But for example, me in Czech Republic, I'm in the situation when I won't make business for them in this field. So it would be pretty nice if they could help us, knowing that they are not cutting their business, because there will be no business with them since we don't have money for this, and there can be some other benefits for them, and I'm pretty much open to use them, like some marketing and stuff like that, because we won't be able to make a tender and for these highly priced companies to win. We will never have budget for this, so they're not cutting business when they're helping us.
Okay. Thank you. It's quite, yeah, it's a testimonial from the reality that you're living on every day. I see a comment that I will put on the screen, and it's linked to a follow-up question that I had for the group. In fact, so question from Sunil Abraham. Christopher, you're mentioning these tests, running these tests and making sure that you can link the knowledge that is there and also the practicalities and how to react to the threat and how to build resilience. Building from that question, so is that something that is in capacity to be done at crisis time? So that's one side. And the other side, how do you feel that this knowledge and how to test, what to test, is understood across the sector? Or is that something that is more ad hoc? Or is there like an exchange of best practices, a network, of a healthcare cybersecurity expert that will exchange the best practices there?
Sure. In terms of drills, I think we've done a variety of types of drills, and some haven't done in clinical areas, others that we've done whole house. So depending on the type of drill, I kind of evaluate first whether it'll have an impact on patient safety. And if there's any impact to patient safety, we won't do the drill in any place clinical. So it is an evaluation that we do first. But involving a lot of the doctors and nurses and other stuff in drills can have very interesting results. Like, for example, when we did the ICAR test string incident, we had AV prompts going off on computers all over the hospital. And one of the interesting things was, to go back to Martin's point about clinicians not often paying attention to cybersecurity, not one doctor or nurse actually bothered to report the AV prompt going off on their computer. So it was one of the interesting things, and identified a need for training that we have since addressed in the hospital. But looking at people's behavior and how they respond to an incident can often yield some very, very interesting results. And I do think some testing in that regard is probably worthwhile to identify deficiencies in staff knowledge, where things like that could be improved. But yes, there are definitely some exercises. Like, we did a mock ransomware once, where we replaced basically Explorer EXEing Windows with a fake ransomware screen to see how certain parties would respond to a ransomware attack if people would properly report it and leverage things after we did a lot of our training. But that, for example, because it took over the screen, we didn't do in clinical areas. We just targeted people on the back end of the hospital. Things like human resources, some finance computers, things like that. We didn't do that on any clinicians' computers. So we do a risk assessment first before we do an exercise like that, to make sure that it wouldn't impact patient safety in any way. But I do think they're definitely worth doing and testing the people response, not just the technical response. It's also a great way to test IT too. For example, with the ICAR test string, one of the things I was very happy to see was that the IT staff actually was able to track down the computer running the script and spreading the ICAR test string to all the other computers in the network. So that was, very encouraging to see. So it's really nice to test the people as well as the technology too. So I do think you have to be careful in doing those kind of tests. You have to plan it well, make sure there will be no impact on patient safety. But I do think it's very worthwhile to run exercises that also test the people, not the technology.
Thank you, Christopher. Dimitra, you wanted to add something?
Yes, I wanted to add on what Martin was discussing just before. So indeed, the member states have noticed that there is a need for support in the hospital. So in different member states, they have coalitions have been created where they offer pro bono services to hospitals, so cybersecurity services, legal services, etc. And similarly, all the European Union institutions have mobilized their communities and their networks, and they share weekly information on cybersecurity incidents. So information coming from ENISA, from CERT-EU, from the European Action Service, from Europol, and the European Commission. This is disseminated across all the institutions, and every week one full report with analysis on the current situation and additional measures and recommendations is sent to the national competent authorities. And from their side, the national competent authorities can share measures and good practices to the hospitals themselves. Like the event, the incident that Martin talked about, so the Czech Republic National Cybersecurity Authority, they issued a very nice publicly available document that was giving information on measures, and this was shared with all the hospitals across the 27 member states through the national competent authorities network. So there is a mobility taking place, but for sure information sharing is now in a testing mode, let's say, in Europe, and we want to see how it will work under a crisis situation.
Thank you, Dimitra, for this, and I wanted to thank the three of you for this very good opener and very insightful also to link to the next panelist in terms of the knowledge is there, the talent to identify the threat is there. What is lacking clearly from what you were saying is the resources, is this capacity to try operational approaches. Christopher was mentioning testing people and technologies, to also embrace information sharing that could be put in place by wider framework, as Dimitra was mentioning, and and how also to be in capacity to interface with potential help. So the one that really can help you because they are just there, or the one that would just be impossible for you to absorb because in terms of budget or capacity, it would be off topic. So we'll build upon that in the next panel. But Dimitra, Christopher, and Martin, thank you already. Don't hesitate to shoot your question and comments, and to the other panelists. Would be very interesting to have this exchange of views in between the clusters. Thank you already.
Thank you very much.
Thank you.
So moving on, and in fact also a call to the one looking at us now and that would look into this video later in the following days, would be very curious to learn from the audience what is your perception on this reality. What is the capacity of the healthcare? How do you see the asymmetry between attacks and defense in that specific context? So we opened a survey that will be plugged on the screen, and we'll link you back to it at the end of the CyberPeace Lab in order to welcome your views on this. Second panel, we'd like to welcome our three next panelists. That will debrief us from the point of view of the one that wants to help and grew very sound expertise and capacity to understand the kind of support to be provided. So welcoming Erick Galinkin, principal AI researcher in Rapid7 and volunteer in the Cyber Threat Coalition. He will tell more about this. Beau, co-founder of I Am the Cavalry, and Pierre Hayaert, future application at Airbus Defense and Space Innovation. if I could start with you, Beau, if that's okay with you, if you could walk us through this concept of volunteering and crowdsourcing the willingness and the human intelligence in order to deliver something of use for different fields, and today looking into the health sector.
Yeah, sure. I've worked in kind of volunteer efforts on improving the cybersecurity field for several years with the Cavalry, which is a group of cybersecurity researchers essentially that decided to stop sitting on the sidelines and kind of help participate in improving things. That's been going since 2013. Excuse me. And I think we tapped into some latent potential in the information security, cybersecurity researcher communities that really want to help, that have a skill set, but that just didn't feel they had permission or didn't feel they had the right mix of skills to do something. And what's interesting is looking at our work over the past 7 years or so from the Cavalry, which Christopher mentioned earlier, and looking at how initiatives like the COVID Cyber Threat Coalition and the CTI League have formed. It very much draws on that same sense of camaraderie and volunteerism, the protector instinct. People who want to, they see a burning building, they run into it rather than away from it. And what's been really interesting is to watch some of these more recent initiatives spring up, get really quick adoption, be able to incorporate some of these researchers into what they're doing, and really make a huge difference. If you look at the CTI League, I'm sure Erick will speak more about the coalition in just a minute. The CTI League has a couple of thousand members that are actively working on doing lawful takedowns for command and control domains, for malicious domain registrations, for disinformation, for botnets, and all kinds of other related to COVID-19 and some of the cyber attacks against organizations, whether they're healthcare institutions or just relying on the fears of COVID to be successful in exploiting people. It's really, I think, a testament to this new group or new type of actor that in a lot of ways is joining the global stage alongside governments and large corporations and even small corporations to be able to make a difference directly. And engaging with that type of an audience can be really beneficial for public policymakers and others who want to understand what the capabilities really are in the world today.
Thank you, Beau, for this opening. And while you were talking, I was looking into the comments that were illustrating what you were saying in terms of the volunteering model, and I will just put that one on screen and to open also the question for the colleagues. Really, if you could walk us through when it comes to sustainability of the model, Erick, that would be interesting, because that's an angle, it's a question that comes a lot in terms of how do you ensure, there's two main parts, how do you ensure trust and how do you ensure sustainability? So if you can go to on these topics would be interesting. Thank you, Erick. Sure,
yeah. So, right, the trust model is pretty easy. So I'll address that first, right? At least in the Cyber Threat Coalition perspective, what we do is we make everything open and available, right? Everything is immediately available. We're extremely transparent about our methods. You can join and ask. We hold weekly town halls where we talk about what we're doing. We release once or twice weekly threat advisories. We're extremely transparent about exactly what we do. And we're happy to discuss the technical details, right? There's no intellectual property that we're protecting. None of that. We're just producing lists of indicators that we want to get out as widely distributed as possible. I know that some companies have started integrating our threat feed into their own threat feed, and we're happy about that, right? We want that information to get out. So I think that as far as trust is concerned, as long as we remain extremely transparent and open about what we're doing and when we're doing it, that's great. And we don't have any issues with trust there. If somebody disagrees, I'd be more than happy to address that disagreement individually. Beyond that, the sustainability is a really hard problem, but I think Beau kind of alluded to that, right? I Am the Cavalry has been around since 2013. It's now 2020. That's 7 years of just volunteers. And so we're going to have churn in our volunteers. I know that even in the 2 months, 3 months, time is completely made up at this point. I don't know how many months it's been. I want to say it's 2. That the Cyber Threat Coalition has been working to distribute these indicators and vet these indicators. We've had churn even in our steering committee. Core volunteers have left. Sometimes they've left and they've gracefully handed off their work in progress to other people. And sometimes people get busy and we never see them again. So as long as we let people know that we are around, and as long as people have an avenue where they can get engaged, we see people come in and volunteer anywhere from minutes of their time vetting individual indicators to hours and hours and hours of their time, right? Our steering committee has people who spend 20, 30 hours a week working on this, on top of their job that actually pays them, right? We have no financial incentive. This is just us trying to make the world safer.
Thank you. Thank you for this, Erick. And yeah, that's a good link with what Beau was saying in terms of the model, and over time how the model can grow and develop itself on very specific. I mean, learning by and getting more. More trustable. And I really like how you explain how trust was built in terms of how to organize transparency, information sharing, etc. Thank you for this. Pierre, looking at this from a different angle, so how these volunteer activities and network interface with other initiatives or the framework or policy framework or operational framework. If you could dive into that part of the topic.
Yes, thank you, Stefan, for the invitation. So Pierre Hayaert, so as you probably hear, I'm French, I don't have that great of an accent, but I do my best. I'll focus a little bit on sharing the legislation around CNI in France and in Europe. So first, CNI, what it is. So CNI, Critical National Infrastructure. It's a number of entities. So it could be companies, government, hospitals, for example, which government in France, in Europe, in most countries actually, have decided that need to be protected in a special way. So if basically the criteria, if this entity goes down, it creates a big mess in the country. So examples are energy, water, transport, and of course, healthcare. So in France, there is a list of those entities which are subject to those special law. I cannot give you the list because it's secret, but it's a fairly restricted list, and not all healthcare entities, and very far from it, are part of it. So why should we care about those laws? And here I'm going to focus mostly on French laws, which is one of the most specific. There's 3 main reasons why we should care. The first one is that the laws are really, really restrictive. And if you don't follow them, then you can be considered a criminal, and then you get into serious problems. The second reason is that those laws put in place measures to protect CNIs from cyber attacks. And their objective is to be really paranoid in a way, very restrictive, but it's never perfect. And if you try to help with best intentions, you may actually create a cyber vulnerability by letting potential information to cyber terrorists. So it's important to know what you can do, what you cannot do, but also what you should not do, because it's sometimes not all black and white, as you may know. So to be a bit more specific on this, the direction of information flow is key. Basically, if you are asking a CNI, a hospital, for example, to communicate information, that's a dangerous area. So obviously password, you don't communicate password, but it can be IP addresses, it can be which is the brand of router, it can be even the software version of the firmware into some kind of equipment, PC or router, and so on. And this is sensitive information which is protected by the regulation. On the other hand,
just sorry, if I can, holding on that thought, something that you're just mentioning now that is really on a technical level, and in fact we have a question that ties a bit into this. So I will start with Beau and Erick, and then coming back to you just to look into that, because it's really echoing what you're saying now. This technical reality of the healthcare and the legal reality that is putting a framework in what you can do, what you cannot do, how does this match with the skills and capabilities of cyber volunteer network? How can we make sure that one is responding to the need of the other in a framework that is sound? So Beau, Erick, if you would like to start.
Yeah, I'll start and then hand over to Erick. I think there are a lot of things that volunteers can do and do very well. There are a lot of things that it's probably not the role for volunteers. And this plays in a little bit to the earlier question about how sustainable is volunteerism and some of these efforts. Within some of these organizations, we coordinate very closely with, for instance, law enforcement, if we're doing lawful takedowns of domains or disinformation bots, so that we're not either accidentally interrupting an ongoing investigation, and so that we make sure that they know that we're helping to clear the battlefield. And in fact, within the CTI League, there's several members of global law enforcement, not just the US, but around the world, who work together to coordinate. And it's interesting to watch that develop. Law enforcement has capabilities that no volunteers have, except law enforcement volunteers, and even then only acting in their professional capacity. So we work hard to do those handoffs and to make sure that those go really well, because we recognize that there are limits to what volunteers can do. This doesn't. We don't want this to be like a vigilante situation where people are just running around rampant, doing things on their own accord. We want to work within the lawful system. In addition, if you look at, for instance, giving direct support to healthcare providers and hospitals, there's a lot to be said for having the people who implement things have a piece of ownership of maintaining them. And you can point to countless situations, not just in cybersecurity, but in other areas where somebody comes in, does a great thing, but there's no follow through. There's not a lot of support on the back end to make sure that it is sustained long term. And I think that some of the hands-on work with healthcare is one of those areas. But one of the things I think that, or at least I hope to come out of this, is that the spirit of volunteerism doesn't go away. It just transitions to other causes, right? In the US, we have an election coming up. We'll see some of the same actors trying some of the same types of techniques around these elections. So you can channel it to something different, or people can go from one volunteer type effort to a different one where their skills might match better. And secondly, I think that, or I hope that this volunteer spirit carries through into people maybe leaving banks as we heard earlier, and going into healthcare so that they can be a part of the long-term sustainable future, even though the money is not quite as good, and even though the stress is, in a lot of cases, a lot higher. And I worked in healthcare, and every day the stress load was really, really high, thinking about what rests on your shoulders. So I would love to see these types of volunteer efforts become non-volunteer sustainable efforts, as well as sustainable in different ways, with that capturing that volunteer spirit.
Thank you both for highlighting the different aspects of sustainability. Yeah, that's interesting one. Erick, you want to build on this one?
Man, following Beau is tough. I gotta say that's not my favorite.
Sorry about that.
No, it's all good. And yeah, I think right. I don't think that volunteerism and that having these organizations is ever going to limit what a hospital or any organization is doing, right? I think that by virtue of us volunteering, by the virtue of CTI League, CTA, right, the Cyber Threat Alliance, the COVID-19 Cyber Threat Coalition, all of these different organizations doing information sharing. I don't think that any hospital administrator who is deciding their budget for IT and for cybersecurity is going to, be going down the line items and say, oh, well, the CTI League or the Cyber Threat Coalition exists, so, we can slash that budget, right? The decision makers probably don't know that we exist. And so really who we're helping are these stressed out, overworked individuals who don't necessarily have the money to buy threat feeds, who don't know how to integrate the threat feeds with their 15-year-old hardware. And we can kind of enable them and make their lives easier, right? And one thing that I mentioned on a different interview, but something that's really stuck with me and something that really makes these volunteer efforts worthwhile is one of my former managers said when we were talking about information sharing, this is already really hard. Threat intelligence is really hard. And, the bad guys, the malware authors, the people running these botnets, whoever, right? These attackers, they don't care whether you're using Rapid7 or Cisco or Palo Alto, right? It's all the same to them. So the only thing that we do by not sharing with our colleagues, really, right, our competitors and our colleagues, is make it easier for people to get hurt, make it easier for all of our customers to lose money. And so we're really incentivized to kind of work together as closely as possible, and then let people let sales deal with that side of things, right? And so I think that kind of perpetuating that spirit of collaboration and cooperation across the threat intelligence space, and really saying like, hey, I don't care if you're brand new, I don't care if you're if you've never done this and you're just interested, right? You work in a completely different field and you just think it's cool, right? We'll help you, we'll teach you, and you can learn how to do it and you can contribute. Everyone has value in this and everyone can contribute. And as long as we make sure that everyone of every skill level knows that they're welcome and that they have value in volunteering, I don't think that it's ever going to slow down. I think that it'll be sustainable as long as we remind people that they can contribute no matter what their current skill set is.
Thank you, Erick, for this. And then going back to Pierre, because he started with the comments that you did, Pierre. There's a comment, in fact, in the chat that gives a bit of flesh on this. Let me put it there. Sorry, my bad. You were mentioning, Erick and Beau, something around information sharing, and Pierre, you were just describing the type of information and the framework that put that possible or impossible. I would like to understand from your point of view, Pierre, how you would see that this this makes sense when it comes to the capacity to share this kind of information. And to go to a Lenig question, can we draw patterns? Can we see modus operandi at scale across region? So is that feasible in the framework that we have? And how do you see the cyber volunteer construct helping there and enforcing this information sharing?
Thanks for the question. There is really, I think, something to have in mind is that the laws apply only to a very restricted number of entities. So you have to know basically if the entity that you're working with is subject to special law, because then it's you have a legal responsibility not to do certain things. Now, in most cases, the entity is not a CNI, is not subject to the law. Doesn't mean that you can do anything, and all the law, the laws which are applicable to CNI makes a lot of sense because they help to protect the entities. So basically, what it says is that anything which is information about the IT system of the entity, any specific knowledge shouldn't get out of the entity. It cannot be worked by remotely. It cannot be transferred. It cannot be. It just cannot be shared. But what you can do, and what is, I think, a very good thing to do, is to provide information in the other direction, which is you can provide best practices, you can provide use cases, you can provide threat analysis, you can provide a lot of things which information security officer in most healthcare entities are really lacking in terms of capability, information, any kind of, in a way, education or help. The thing which is really tricky is when you really want to help, and by helping, I mean that if you can help to sort out problems, you need information from basically the system. This is where the line is really difficult. This is where you should be conscious not to step and get some of the information which is protected out of the entity.
Thank you, Pierre, for this. Putting this into a wider context. There's a question then that comes to mind when hearing you discussing about this. This model of support, and looking also into the comments. How do you think, from the point of view of the healthcare, so the one in need, the one that are at crisis time or before the crisis, how can they identify the right partner to engage with? How can they find the path in this maze of initiatives, framework, trust model? What would be the best practices there?
Yeah, we thought quite a lot about that within the CTI League, and how we could kind of be that trusted party, or at least identify ourselves within healthcare. And so we actually worked with HHS through some of their initiatives that look to kind of join the public sector and private sector to come together and use that vehicle where, there's groups within HHS, there's groups within some of the other industry organizations like HISAC, Healthcare Information Sharing and Analysis Center, or the Healthcare Sector Coordinating Council. That already has trust relationships, and essentially work with them, walk through what we do on our side to work on these types of issues, how we vet volunteers, how we do those types of things. And we brought them in. So we actually have members of HHS and members of the healthcare ISAC sitting in our conversations. And they don't have to rely on, someone that they don't necessarily trust. They can have, as Erick said earlier, the evidence right in front of them. They have the actual facts that they can then take and act on behalf of the healthcare institutions. When you start talking about longer term engagement, employment or something like that, it gets a little bit different, and each healthcare organization has their own identification and vetting processes. But we want to be as available as possible, get the information out in as many pathways as possible, and help those who can help themselves from an individual level, but also work on building the class protections that things like domain takedowns can do. So, somebody doesn't have to trust us if we've already taken down the domain that was phishing them.
Right. Yeah, that's great. And I kind of reject part of the question because none of these initiatives are mutually exclusive, right? You can partner with the CTA and the CTI League and the Cyber Threat Coalition. Really, we have a lot of really tight-knit relationships between those organizations too. So it's not, there's a lot of overlap, I guess is what I'm trying to say. And there's no reason why you have to pick one over the other, right? We're not vendors. We are information sharing bodies, and we share information with one another. I know that we have lots of members of the Cyber Threat Coalition and even members of our steering committee who are members of the CTI League. We had Neil Jenkins from the Cyber Threat Alliance present at one of our weekly town halls. So, there's no shortage of ability to work with all of these and aggregate all of these sources of information, right? You don't have to pick and choose.
Thank you, Erick, for this. I guess the question was also around the understanding what the initiative can deliver for the healthcare professional that at that moment would be in need. So not so much that you have to pick and choose, but not even going there, just to understand what's there and what is the environment. And also question that I see popping on the comments when it comes to the composition of the teams. I guess all within healthcare or outside, maybe something that you can comment on. What kind of profile make this a potential possibility? So I'm quite sure there's no recipe, but would be interesting to have your comments on this. Anyone? If Pierre, you would like to start?
Yeah, sure. I think I come back to what I said earlier, is that most entities in the healthcare sector are not CNIs in the sense of the law, which means that there is often a huge gap between state-of-the-art cyber protection, I would say, reasonably good protection at an affordable price, and where some healthcare entities are. And for most healthcare entities, there is no issues into working with volunteers and improving the cyber protection, because simply there is no law which applies to them. They just need to do better, let's say, cyber protection. So I think that the question with regulation, where it gets tricky, is a question you should ask basically to the IT responsibility of the entity, probably going to be a hospital, and say, are you a CNI? Are you subject to special laws? And this is his responsibility to know that. In most cases, it's going to be no. And then I think it's much easier to find a way to work together and to avoid maybe the legal challenges which are involved in CNIs with regulation.
Thank you, Pierre. Any comments, Beau or Erick, on the multidisciplinary part of the question?
Yeah, looking at how organization staff, it's always really interesting. Some of the highest performing organizations have really highly multidisciplinary teams, and in particular, I'm thinking of one medical device maker that recruits, journalists to be able to help with their coordinated vulnerability disclosure, because communication is such a key effort. To recruit people from the soft sciences. I have a degree in psychology, believe it or not. I know a lot of other people who have degrees in philosophy, and they're just amazing at what they do. I think that having a multidisciplinary type team maybe is the dream team, all working towards a single goal with a sense of empathy and respect, and kind of helping to pull these different perspectives together to make something greater than they could have done independently or just with one single perspective on the problem.
Thank you. Erick, anything to add on this one?
No, I think that's great. Yeah, having an interdisciplinary team, bringing in people who are not necessarily cybersecurity professionals by training has immense value.
Okay, thank you for this. Thank you for this insights. I think a lot of you has learned a lot about these initiatives. I think one of you mentioned it that are not sometimes not even known at national level, etc. So that was also the aim here to debrief and provide lights to it. We put into the comments some links on various initiatives. Please don't hesitate to add additional links. I mean, that's the whole idea, that people can benefit from this CyberPeace Lab and to know more about that. Thank you again. We'll move to the next part of the discussion, and looking into what can we build from this. So we have this need, this demand that is now under heavy stress because of the crisis, because of what is happening in COVID-19. So we underline until now this, the knowledge of the threats, but at the same time the lack of resources in order to respond. And this initiative that works, that showed over the years a capacity to react. There were some questions and really good points raised by the panelists when it comes to how to make them trustable, sustainable. How can you understand what's there and just how to interact with. I'd like to touch in the next panel on exactly this sustainability, looking forward, and also how these initiatives interact with other models, models that are run by government or models that are run by the private sector. So welcoming Jen Ellis, VP of Community and Public Affairs for Rapid7, Peter Spirik, Cyber and Privacy Leader for PwC, and Megan Stiefel, Executive Director for Americas of the Global Cyber Alliance. And thank you for being with us for this last part of the CyberPeace Lab. I would start with Jen, if it's okay with you. Just building on the keywords that were raised during this last two panels. So we spoke about interfaces in between different initiatives on different levels, being volunteers, being governments, being private sector, and in the middle of that, this question of trust and sustainability. So if that's something you can touch upon. Thank you, Jen.
Yeah, so I'd like to start by just saying, I think the speakers who went before, did a really incredible job of sort of summarizing some of the challenges that you see in the healthcare sector in terms of complexity, in terms of how diverse the sector is in terms of the types of organization, the resources they have, and the challenges that they're facing. And so when we start talking about this, even in a region, so even if you look at sort of the US, for example, because we talked a lot about the US, the range of capability, resources, availability, maturity, sophistication, all of that is just astonishing across the sector. And then when you look at it internationally, each country handles it differently. And so as you start thinking about how you go about building trust and building engagement, and the private sector getting involved, vendors getting involved, the nonprofits getting involved, volunteers getting involved, there is just there's an incredible complexity in the environment, and it isn't a one-size-fits-all approach, really. What you're able to do, and what we've seen the volunteer organizations do really effectively, is basically make themselves available and then focus on the organizations that they're able to reach, and they are able to work partnering with the governments to amplify that reach in regions where the governments are, really sort of helping the healthcare sectors and trying to reach into them. And so they get that boost that way. So it's a very brilliantly symbiotic win-win relationship. And I think the trust elements are actually sort of built by that symbiosis and that sort of credibility that they each provide to each other. You've got these researchers with deep technical skills coming to the table, which is magnifying what governments can offer the healthcare sector, because it's giving them all these resources of capability. But then you've also got the credibility that comes up from the government relationships which have already existed with the sector. And so I think there is this sort of revolving relationship here that is hopefully supporting everybody. I think the question is whether the healthcare sector is on the fringes. We have a lot of healthcare organizations that are more engaged with the government, or are bigger and more mature, or have the resources to dedicate more to these relationships. But then there's a lot of healthcare organizations that are small, that are regional, that are independent, that are, for whatever reason, much more limited on their resources. And I think it's when the dust settles on all of this and we do the analysis afterwards, it'll be interesting to see whether they were able to participate and whether they were able to benefit, and what that will actually mean for them in terms of the long term, because traditionally they have been the very end of that long tail of security. And so seeing whether this will help boost them forward in the long term will be interesting. And in reality, they have so many other fish to fry right now, so much other stuff to focus on, that it's hard to know whether this will make a difference in the long term to them in cybersecurity.
Thank you, Jen, for this. This opened nicely to a follow-up question at operational level. So you're mentioning symbiosis, the trying to make sure that this partnership would allow everyone to amplify the reach. Better on this one, looking at this from the technical and the tactical angle, what would you see could work in that framework? And also interestingly to hear what you think is really could be seen today as blocking point.
So I think what's really a problem to solve, and we have touched this briefly in the past, is the information sharing. When I speak with pretty much everyone, not just in healthcare, but across all the firms, every single CISO, or 90% of them, are saying information sharing. That's what we need. That's what's going to help us react faster, be more efficient, and overall be better and more protected. The problem with information sharing is that in a lot of organizations, the mindset is, I would like to take, but I don't want to, or as we heard before, due maybe some regulations or even internal lawyers, I'm not allowed to share. So it's like the chicken and egg problem, where everyone is, I will share as soon as the others will share, and we are not going anywhere. So it's like the trust issue to some extent, but to some extent it's blocked on the regulations and policy level as well. So I think this is interesting topic to solve. To some extent, it has been solved by the industry organizations like FS-ISAC for the financial sector and elsewhere. I think there is still work to do. Second, what I think works or starts to work quite nicely is the linking of the pieces together. So, for example, right now in the Czech Republic, where we have both the COVID-19 pandemic and the attacks on the healthcare, what the Ministry of Healthcare did, as it seems like a simple, but it's actually very powerful and brilliant idea, is they put together in one Microsoft Teams folder 2 parties together. They invited the private companies, then invited the healthcare institutions, and basically facilitated the exchange of private sector. Show us what you are offering that should be or could be helpful to the public, to the healthcare. Healthcare, here is the offering from the private sector. And the caveat is some of this, and please indicate it, private companies, you can have for free on like voluntary basis because the companies want to do the right thing for the society. The others are just bigger and it's commercial offer. But at least the two of you are linked in much easier and streamlined way. I think it's a great start forward. In the future, I can imagine going this to state guaranteeing some things like minimum fund coming from the state to cover at least like the cost for some private companies or something like that, but that's tricky. And that's actually like the third point, like what's preventing us actually in doing better and more sustainable, and that's money. Because from like the private sector company, I do cybersecurity as a business. So whenever I'm offering my team or myself for free, and yes, sometimes I'm also volunteering in my free time, and then I'm basically competing with myself on the commercial field, which is weird feeling. It's basically the question of is it sustainable? And there are two ways how I can make it like a good for like mutual, and it's like the symbiosis you mentioned. And one of them is like for low stake type of engagements. I can take it as like a training ground for more like the junior people in the team. And if it's something like low hanging fruit, where essentially the healthcare or the organization needs just something simple and they just don't have anyone to do that, I can use it like to do a good thing and train the team. So that's one thing, but you don't want to do it in the cyber attack. Then like is the high stakes situation where I can take it as a PR/marketing campaign where I demonstrate how I can help. And for me, it's always better to do this than invite journalists for wine and refreshments. It's actually helping someone, but it has its limits. But then there is like the third part where essentially I am cannibalizing my own business. And yes, sometimes the company is going to do the decision, either way, we are going to help, but we are recognizing that it's cost to our profits, to our income, to our revenue stream. And that's like the tough situation. That's like the charity type of things.
Thank you.
And the third one is, I think, where we need to think more about how to make it more sustainable.
Thank you, Pierre, for this. The something that you mentioned, in fact, it's would love to hear Megan's view on this. It's this matchmaking system in terms of you have so the healthcare on the side. On the other side, as Peter was mentioning, you have an offer that in that case was the private sector, but we could think about this, the volunteer network that we just spoke about, or what is coming from government. There's also other initiative or civil society. In the Global Cyber Alliance, you have quite a wealth of knowledge when it comes to providing this kind of service to various actors. How would you think about this matchmaking and the challenges?
Thanks, Stefan. Good morning and good afternoon. I appreciate the opportunity to join all of you today. So GCA in some ways is the Global Cyber Alliance is an entity that does some of that matchmaking. We work to assess the gaps in the space in terms of capability and offerings, and identify where there may be private sector offerings that can be brought to bear that are low cost, that can be responsive quickly to the challenge. So but I think in terms of that matchmaking, in order to do that matchmaking, we're in some ways jumping quickly to a technical matchmaking, and that's important, but we have to keep in mind some of the non-technical elements that are critical to the success of that technical matchmaking. And we've touched on a number of those today. They include trust, in particular, the ability to, as was mentioned in the first group, the need for and requirement of the need for and the desire for transparency. Also thinking about acting as responsible partners in this space and trying to manage this, both the pandemic, but also the technical aspects of bringing healthcare to this critical need. It's also important when we're doing the matchmaking to assess that, to confirm that we're looking at trying to build complementary efforts, that we're not looking to duplicate necessarily where where an organization has a particular capability to bring. We don't need to spend time reinventing the wheel, so to speak. It's best to really work to build and bring the pieces together in a way that's most cohesive as possible.
Thank you, Megan, for this. I wanted to build upon something that you were just saying, the non-technical side of the matchmaking, because that's happened a lot in the cybersecurity environment. It tends to become a technical conversation, but the non-technical part of it is quite important into the setting up the framework. How do you feel about the maturity of this symbiosis, again coming to what Jen was mentioning before, in this non-technical matchmaking that you were mentioning? What's the maturity of it today? Jen, you provided some insight about this when it comes to already at the regional level it's complicated, national level also to think international is quite complicated. So if that's the state of play, what should we look into? What should we invent to make sure that what works somewhere can be replicated, or at least could be looked at from somewhere else to learn something about it?
Yeah, it's a good question. I'm not sure it's the right time to ask it, because I think that when you're dealing with a situation like the one we have today, you create patches, and you have to, right? You have to be quick and responsive and make it work, and everyone is more willing and actually to some extent more able to just muck in and make it work, and to be a little bit more flexible. There's sort of like that freedom that people have to do that because there's such a strong need. But I think how you build models for collaboration in the long term will differ and should actually be based on some analysis of what worked and what didn't, and what the needs were that were identified, that you do after the dust has settled and after things have calmed down and normal business has resumed. One thing, though, that I do think that's really positive that will come out of all of this, that I think, or I hope, will create the foundation and the baseline for those discussions, is that in this situation, we have seen a lot of people kind of, we have an expression that we use at Rapid7 all the time, grab a shovel, meaning, just being willing to like jump in and help out, whether it's your job or not. We've seen a lot of people do that through this situation, and we've seen that happen on both an individual volunteer level and on an organizational level. So some of the folks mentioned earlier, these volunteer groups like the CTI, CTC, the Cyber Volunteers 19, there's a few others around. But also they mentioned that some of the bigger tech and security companies have jumped in. We have seen a lot of the individuals that have been participating backed by companies. We've seen a lot of companies coming out with free solutions and offerings, offering services, offering their people and their expertise, throwing in IOCs, all this kind of stuff. And I think what that's done is that it's sort of done things in two directions. One is, I think, for a lot of organizations that thought they understood what the healthcare sector was all about and what it was dealing with, it's actually kind of brought that home in a much more real way. And I think has massively deepened that knowledge and that empathy of what the situation is in the healthcare sector. And then in the other direction, it's helped the healthcare sector understand what's available and what's out there, and what are some of the things that they should be thinking about, and who are some of the players to sort of work with. And so I think, I don't think that we're going to come up with the right models for long-term participation now while we're dealing with a global crisis. I don't think it's the right time to come up with long-term models. I think right now what we have to do is deal with the global crisis. After the crisis is over, when we're able to do the analysis and share information about what worked and what didn't and what we learned, then we'll come up with models, but we'll be in a much better position to have that conversation because of, honestly, the education that's happened in all directions through this process, and the empathy building and the trust building.
Thank you, Jen, for this. Very interesting, in fact, the timing of when to ask the question and when to be in position to answer it. This analysis that you're mentioning, so that we are going to look into what worked, what didn't work, and then we can build some models out of it. Megan, is that something that you could that you could give shed light on? Do you feel that we have the capabilities in place today to get these information points? what we need to learn about what worked, what didn't work. Is there a way today to harvest this information in order to pave the way for this analysis? In order that now we react, now we invent, now we are there in order to act. But how at the same time do we put in place feedback loop that we can then build upon in the future in order to do this analysis? Any views on?
I would like for it to be in a better place than I think it is at the moment. So from my experience in watching the maturation of cybersecurity response over the past decade and more, I still feel that we are not always in the best position to look back and to do some looking at lessons learned in case studies. And so I think what can help that in particular, and well, first maybe I'll speak a little bit to some of the reasons why I think that may be. There's still a concern, I think, and I will leave to others to decide whether it's a well-reasoned one around the risks to sharing the impact of an event afterwards. Primarily around the liability that an organization might face. So acknowledging that there were weaknesses in the system that were not not patched, can limit the ability for us to learn from these events. But at the same time, I think it's important to understand what can facilitate better lessons learned. And as was, I think, in the first or second grouping, mentioned the need, it was the first, I believe, for organizations to take steps, preventative steps, to in the first instance, undertake a risk profile and understand where the risks are, so that after the fact, we're able to look back and say, oh, we conducted our risk profile, and actually something that we assessed to be a low risk ultimately turned out to be quite impactful to our organization. So I think, again, that comes back to trust and the ability, not only so individual trust, but also looking at policy and regulatory frameworks that might facilitate better the ability to do greater lessons learned and case studies of critical events like this.
Thank you, Megan, and I appreciate the opening when you said that. Yeah, if you go back in time, already there's been a lot of crises. Did we learn already something out of them, and how worked from the past to today in terms of analytics, and to transform this into already models to be better prepared for what is happening now? So interesting also to look into that, because a lot of what is happening now is not new, in fact, and issues that are systemic issues were there from the past. I think, Peter, we were highlighting specifically one of them in the comments on IOCs. So practically speaking, can you develop on it?
Yeah, so I think that sometimes it's also important to take into account that it's not the information that the healthcare or the any victim organization really needs. It's the intelligence on what to do with them. So I have seen it multiple times when the organization receives IOCs, be it from government, from their vendor, or from their partner, or from their even own administrators doing open source search, and they end up with hashes, with IP addresses, with IOCs really, and then the question is, now what? And a lot of organizations are actually missing the now what capability. How do I look for the IOCs? What do I do with the IOCs? Do I just look for it? Do I block it? How do I validate the IOC so I'm not accidentally shutting down my infrastructure? When I find the IOC in my environment, like let's say hash of the file, what does that mean? What's the next step that I should do? And this is something that I quite often see missing from the IOC distribution channels. And sometimes I hear it as a struggle for the receiving organizations of these IOCs. So my maybe advice or call to action to anyone who is generating these IOCs in a good faith and trying to help, invest also a bit more into giving the advice on what to do about it, because that's sometimes what's also missing in the target company or organization.
Yeah, something that is in between the information and transforming this information position to action, that you can really do something. Yeah. Okay. Yeah. Very, very helpful there. The I mean, none of us is the future teller, but very shortly, what would you think are going to be the main lesson to learn from this crisis and different model, how they interact with each other for what next? If you would just highlight 2 points that you think, okay, now something changed, or in fact failed to change, and it's been so much in the light that there's no way that we can crack to what it was before. Have you identified something specific in this crisis, or are we, and that would be a bit sad, finding, but still, are we still into discussing the same issues and information sharing problem, trust building problem, how to have symbiosis in between entities that we were discussing in the previous crisis?
You want me to jump in? Yeah, so I mean, the quick answer, I think, is unfortunately, and this probably sounds a little depressing or dismissive or negative or whatever, but yeah, I think we will continue to see the same things come up over and over, and that's something that you hear people in security talk about a lot, is that we see the same issues arise over and over. But I do believe actually that we are increasing knowledge as we go, and that security is maturing and the organizations are maturing. There's a lot of organizations out there. It's a big wide world. So in terms of like the biggest learnings, I think there were lots of things that we talked about and knew intellectually, but we didn't necessarily know in terms of like, hadn't processed what would really be the implications of it. So we knew that the healthcare sector was struggling with cybersecurity, and that not all healthcare organizations were made equally when it comes to cybersecurity, and that having the resources and the capabilities to address it. And I think Chris mentioned in the first panel that, jobs in security and healthcare often don't pay as much in the US. I'm sure that's probably true in other regions. And so the healthcare sector is not necessarily getting the same level of talent. Even when they are able to pay as much, they perhaps don't have as many roles that they're able to open. I've heard stories of healthcare sector where, because HIPAA says that you have to have somebody to run cybersecurity, they've had, the head nurse do it and that kind of thing. And so people who it's not a capability for them, but they also have other administrative tasks in their job function. And this is seen as just another one of those. And so I think that we had this sort of intellectual understanding. There have been reports that came out from HHS and various other healthcare sectors in different countries about the challenges. But what this has confronted us with, this situation, is that it's not enough to just sort of go, yeah, it's a problem. We have a real resources issue here, and we have to figure out how to address it. And, some people earlier on referenced WannaCry. Well, WannaCry was, I think, 2017. And so, at the time, we were all like, we should do something about this problem. We should fix it so that when the next crisis happens, the healthcare sector isn't as vulnerable. Hi, welcome to 2020. And so I think, number one learning is we haven't made enough progress. And I'm going to be even more depressing now. I'm really sorry. Isn't it a good job you're not finishing with me, and there'll be 2 other people after me. But the second thing is I don't think this is just a healthcare sector problem. I think there are other sectors that we rely on in critical infrastructure that we also haven't figured out how to solve this problem for them. And I think one thing that healthcare has in common with some other areas of critical infrastructure is that there are areas where, one, they're reliant on types of technology that are designed to be in place for a very long time. And so security issues remain, and often as new systems come into place and interact with older systems, it creates security issues. So we see that in healthcare, we see it in all sorts of utilities and other critical infrastructure areas as well. That's the first problem. I've totally lost what the second problem was that I was going to say. But I think that we have this sort of long tail that we're going to see around cybersecurity challenges with lack of resources, lack of understanding, and with systems that are sort of baked in for a long, long time. And I know what the second point I was going to make is, by the very nature of them being critical infrastructure, there is this not unreasonable feeling in these sectors that you can't do effective patching or you can't update systems because you can't make the systems unavailable because they're critical. So I think we have to solve some of these problems and figure out how to give these industries that we're super reliant on a little bit more support.
Thank you, Jen, and thank you for this additional finding that we should refrain from having you closing the panel.
Right. Absolutely.
Thank you for this one. Megan, what's your view on this?
I think it highlights again the need to focus on the basics, because the basics can have significant consequences in all cases, but particularly in high-end contingency areas and in critical sectors. So for us as GCA, we work to help build the capability and help organizations implement cybersecurity hygiene actions. So best practices, actually implementing them, not just saying, well, we should really think about how to better secure our email, or are we looking at what is the particular type of DNS service that we use. These small steps can have a significant impact, looking at whether an organization is using multi-factor authentication on critical accounts. So incentivizing the ability to implement the basics is something that should be of even higher focus for all. And I would emphasize too that it doesn't have to come at a cost. So GCA is really focused on making available free resources to implement the basics, which is not to at all suggest that healthcare, the criticality of the technologies that we rely on in the healthcare sector is a simple or a basic thing, but that we need to do the basic security capabilities to then make available resources to focus on those areas that do require specific and highly technical capabilities.
Thank you, Megan. And Peter?
Yeah, I'm not really the right optimist to end with. Everyone who knows me will tell you that. So I will try. I think I will follow up on what we heard so far. I disagree a bit with the fact that we just cannot update critical systems. In my mind, that's backwards. If we know that this system is super critical, people are going to die if my patch is going to break it, then it's even more critical to move it from Windows XP or Windows 2000 to this millennia. And I'm strong advocate in this, like getting the basics right, as we just heard, because there is no intellectual effort required to solve the problem. We are not solving the problem of asymmetric trust. We are not solving the problem of what's going to happen when quantum computing is going to break all the encryption. No, we are solving the problem that we have ancient systems running ancient software that's vulnerable. And the solution to this is either upgrade it, or if there is no upgrade path, just migrate it to 21st century. Like literally it's something that I'm sometimes paid to tell to the clients. It feels like cheating, taking this money, because it's like the best thing. Like, do you have administrator accounts for all your employees? Remove them. Are you protecting your privilege access accounts? Not. Start doing that. Is your critical environment running on Windows XP, Windows 2000? Just don't. And these are advices that, yes, they bring cost because you need to invest in doing the migration plan. If it is critical, you need to build essentially new environment, then test it, then switch over to it. I understand. But technologically, intellectually, this is solved problem. It's just the effort and action that's missing.
Thank you, Peter, for this.
Positive thing. I have one positive thing.
Please.
For this crisis. This crisis showed and demonstrated that cybersecurity is a risk to health and safety in the healthcare. And I think like there is no more ifs or not applicable or it's just IT thing anymore, because we have seen hospitals being shut down because of cyber. And to me, it's grim, but it's like finally we can move on because this question is answered. Yes, it is.
Thank you.
Yeah, it was answered in 2017 with WannaCry as well.
Yes, the second is the recap of the answer.
Yeah, sorry.
Thank you. And conscious of the time, we're already 4 minutes past. I would like to just close in and using the opportunity to have my colleague Adrien Auger, who is the Chief Operations Officer for the CyberPeace Institute. So that I saw was taking a lot of notes when everyone was talking. And Adrien, if you could share with us your final thoughts and how you think that at least as an expert community would like to move forward. Thank you.
Sure. Thank you, Stefan, and thanks everyone. It was really a fascinating discussion. I learned a lot. As Stefan said, I was taking lots of notes. I think what I wanted to close on is the fact that this webinar is not an end in itself. It's not the end of the webinar. It's the beginning, right? I think that you've touched upon so many valid points that we at the CyberPeace Institute really want to build upon all of these and try and help make all those efforts sustainable in the long term. For those of you who don't know, one of the missions of the Institute is to provide assistance to vulnerable populations targeted by cyber attacks. And to do that, we need scale and we need sustainability. We need to do that over the long term, right? It's pointless if we do it for a year and then we disappear. So we need everyone to be involved in that effort. We need all of you. And so for me, when I see those initiatives popping up, it makes me very hopeful that there's a lot of solidarity in our sector, that it's a very cooperative industry. It makes me super proud. But it also makes me think that there's potentially untapped resources. If you think about it, we've had WannaCry, we talked a lot about it. We've had Heartbreak before. We have lots of major events like Olympic Games happening. And then there's a peak in those volunteer initiatives, right? And then it fades away. And I'm thinking that if we can tap into those resources during those events, potentially we could tap into them maybe at a lesser extent outside of those events. Peter, I think you mentioned good ideas around how can we use volunteer initiative to do, for instance, trainings or maybe high-stake initiatives to connect that to, or I don't want to say marketing, but like to amplify a little bit the activities of certain companies. I think there are potentially things that we can do, in particular when we look at the unmet needs that were covered widely today, notably in the healthcare industry, right? We're not able to provide assistance at scale to the industry. When WannaCry happened, what did we do after? Were we really able to change things? Why are we here in that situation today, right? So how can we structure these efforts over time? And I think that's where the CyberPeace Institute can really come into play. We're going to try and work with all of you to derive lessons learned and structure these efforts in the long term. I think we shared the link, the QR code to the survey. So we're already starting to try and understand what would be the needs of the healthcare industry and how we can help those needs be better met by the existing initiatives, whether it's coming from government, private sector, nonprofits, or volunteer initiatives. So stay tuned. Thank you very much. And, we'll be in touch. Get in touch with us, info@cyberinstitute.org, cyberpeaceinstitute.org. Check our website. And back to you, Stefan. Thank you.
Thank you, and thank you for the panelists. Thank you for everyone, the one that we see here and the one that participated to the first two parts of the discussion. Thank you, very insightful. And stay tuned and speak to you next time for the next CyberPeace Lab. Thanks again. Bye-bye.
Thanks. Bye.